Hello, everyone, and welcome to the Parent and Family webinar series. This is our fall edition. Today's topic is Healthy at Brown, Brown's approach to public health and wellness. My name is Mikkel St. Germain. I'm the Director of Parent and Family Engagement here at Brown University. We're joining you from beautiful Providence, Rhode Island, where the rain is slightly stopped and sun is coming out. We have approximately 100 people right now and climbing on the webinar. Many of you submitted questions in advance, and we're going to try and get to as many of those today. But please do enter your questions using the Q&A tool at the bottom of the screen, and we'll try and get to as many as possible. We also have closed captions available today for anybody who needs them if you click on the closed caption button at the bottom of your screen. And this session will be recorded for future viewing, and you'll be able to see it on the webpage where you registered for this event. We do hope you will join us for future webinars. We have some more that will be announced for fall coming up, so keep an eye on your emails for information on that as well. Before we get started, I do want to welcome parents and family members of the class of 2026 who are joining us here today as we start the academic year, and all returning parents and families. I want to make a note about Family Weekend, which will take place on October 21st through the 23rd. We'll be opening up registration next week for Family Weekend, and registration is not mandatory. It just helps us to plan a little bit. So we hope you will register when that becomes available. And for those who are unable to attend Family Weekend, we will have recorded sessions and live stream sessions as well for your viewing. If you have any questions after this webinar, you can send them to family@brown.edu and we will follow up with you. But now that we've gotten housekeeping out of the way, let's get started. It is my great pleasure to introduce to you my campus life colleagues. We have today Vanessa Brito, who's the Associate Vice President for Health and Wellness, Assistant Professor of Medicine, Clinician, Educator, and Vice President of Campus Life and Student Services. Corinne Backegard, who's the Associate Vice President for Campus Life and Dean of Students. Adam Plant, Clinical Director of Health and Wellness. Brenda Ice, Senior Dean and Senior Director of Residential Life. And Tanya Sullivan, Associate Clinical Director, Nurse Practitioner. We will have presentations, and then afterward, we will follow up with Q&A. But while the presentations are happening, please do feel free to enter your Q&A for us to respond to. Now, let's start off with Associate VP Vanessa Brito. Vanessa.
Thank you very much, Mikkel, and welcome everyone. We're really happy that you're here and that we have an opportunity to share with you a little bit about the services that we provide here at Health and Wellness at Brown, and the collaborative work that we do with our residential life partners and how they intersect, particularly as it pertains to the issue of public health. And so we're very happy that you're here. I'd like to tell you a little bit about health and wellness. First slide. So our health and wellness department is a very robust department comprised of, or area comprised of 5 departments. You see them listed here: our health services area, our counseling and psychological services area called CAPS, our Be Well Health Promotion area, emergency medical services, and student accessibility services. 4 of the 5 services are co-located in this beautiful state-of-the-art new building. And it does really, I think, we all think, really gives us an opportunity, along with student accessibility services, to co-locate and integrate the services that are provided for students. So together, we wrap services around students and also, again, have an opportunity to collaborate deeply with our Res Life colleagues and other campus partners. It's really our privilege to take care of and support students at Brown, and we really welcome this opportunity to talk with you in more detail. Thank you. Tanya?
Thank you, Dr. Brito. So within our student health services, which as Dr. Brito mentioned, is part of or one arm of our comprehensive and integrated health and wellness unit at Brown University, we really have what you could consider a Venn diagram of services that really wrap around a student. So first, we have our student-centered primary health care, and we're staffed by physicians, nurse practitioners, physician assistants, a department of nursing, as well as medical assistants and administrative support staff. In addition to that, we have a health promotion and health education department, Be Well Health Promotion, that really does both group health promotion, but also one-on-one visits focusing on harm reduction and health education and health promotion. We have counseling and psychological services, Brown Emergency Medical Services, which are also co-located in the same building as CAPS, Be Well, and Health Services, as well as a 24/7 nurse advice line and provider on call during the times that the health services is closed. So CAPS also has a 24/7 response. So just know that your student can be supported not only during business open hours, but also after hours when the building is physically closed. So two real essential aspects of our health services that are located right within our health and wellness building at 450 Brook Street is our Brown Pharmacy. So we have an independently owned and operated pharmacy that's located within our health and wellness department. It is stocked like any other pharmacy with any medication that would be prescribed by a prescriber, whether it be a prescriber in health services, in counseling and psychological services, or a provider that the student is connected with either through home or a subspecialist in the area. Any prescriber can prescribe a medication to our pharmacy, and it's really exclusively for students. So students are the only members of our community who are able to pick up prescriptions at our pharmacy. We are able to order specialty medications, and our pharmacists are really, really good at working with students and prescribers to obtain and procure, maybe uncommon medications. We also have a small over-the-counter area where students can pick up over-the-counter medications and also essential toiletry items. And this is a pharmacy that is open 7 days a week during the academic year. Our health services is open 7 days a week. So Saturday and Sunday during the academic year, we're open. And when we're open, our pharmacy is also open. Copays apply just like they would for any prescription in any pharmacy. So if a student went to a retail pharmacy, the same copay would apply as it does in our Brown Pharmacy. So it is good to know that this is an option for your student, and medications can be transferred from an outside pharmacy to the Brown Pharmacy simply by calling our pharmacy and asking them to transfer the medication. In addition to a pharmacy, we also have a laboratory, which is the Lifespan Health Lab, which is the lab affiliated with the Rhode Island Hospital Group. So it's important to know that if your student needs to have lab work done, if they're seen in health services, we have a reference lab right on site. Medical providers in health services are able to order labs, and if the insurance allows, we can have the lab sent directly to Lifespan. The results are integrated within our electronic health record. Students may see a provider outside of health services, and they're able to bring a requisition from that ordering provider to Lifespan Lab. It is important, if you have chosen to waive the student health insurance, to verify or check with your insurance company to determine if Lifespan is considered an in-network lab. The best way to do that is to either go online and look at the in-network lab options, or simply call the phone number that's the customer service number on the back of the insurance card. If Lifespan is not considered in-network with your insurance, there are other local labs that students can easily navigate getting to off campus. And the main ones in our area are Eastside, Labs, and LabCorp. So know that those are also options for students. When we're seeing a student in health services, we really take responsibility of making sure a student has verified what laboratory is preferred by their insurance prior to having labs done. So it's an ongoing conversation that we do have with students, but we really do recommend that families and parents work with their student before we're having a conversation about ordering specific testing, to know in advance what lab is considered the in-network or preferred lab by the insurance company. And it does vary insurance to insurance, state by state. In addition to our in-house lab and pharmacy, we have a very robust and highly talented emergency medical services. And so this is a picture of our Rescue One ambulance. So Brown EMS is a 24/7 ambulance and emergency response service. It is staffed by EMT providers. It's also an educational program for students. They have a very astute ability to triage and assess students, both from a medical and also from a mental health standpoint. And they can triage and refer students to the nearest hospital that is accepting patients. And they really facilitate a warm handoff when a student does need transport to an emergency room. If a student is being seen in health services and we determine that they, perhaps need to go to the hospital, it would be determined, is it urgent, emergent, and EMS can facilitate transport either emergently using their ambulance, but also in a non-emergent, more transport, warm handoff way. We have another vehicle that we have deemed the Wellness Wagon, and that's really for Brown EMS to be able to take students who don't need immediate or urgent transport to help facilitate their getting rides to a hospital when need be. So we work very closely with our EMS staff, both in emergency response situations, but also in supporting students who may need to isolate due to a public health or medical issue that arises. Next slide, please. And in addition to Brown EMS, we also have our Brown Counseling and Psychological Services, also co-located within our health and wellness building. And similar to health services and all of the other services in our health and wellness department, CAPS is available and accessible to all students, regardless of their insurance. And as long as the student is on campus or in the greater Rhode Island area, counseling and psychological services is certainly a resource for them. Services that CAPS provides includes counseling and short-term or episodic therapy, and then also psychiatry. There are 3 psychiatrists that are located within the CAPS department. So there may be some situations in which a CAPS therapist recommends that a student connect with an off-campus therapist or prescriber, but all of those situations are handled really on a case-by-case basis and really involve the student in that process. Next slide. And I think I may be handing this off to Dr. Pallant, who's going to broach the topic of public health on our campus.
Yeah, broach is the right word. I'm Dr. Pallant. I'm the clinical director of health services. I'm a clinical associate professor of pediatrics and have been in the medical school in Brown for 25 years. And I'm going to try to do a quick touch on probably what many of you are thinking most prominently about. I will do my best to reassure you. I don't know that where we stand might align with where your best concepts may be, but I do want to clarify that these are not protocols or processes that we have sort of taken on as a small group here at Health Services. We are working directly with the medical school, with the Department of Infectious Disease and the Departments of Health. So it's very, very well thought out. And that, I'm going to be brief, but touch momentarily on COVID, influenza, monkeypox, and pretty much everything else, including mono, GI bugs, and the like. Not into detail on every one, but hopefully to give you the broad brushstrokes of how we interface with students in these circumstances. So let's go for broke. This is the most controversial slide, but I hope that once again that it will make some sense. It is COVID-19. I want to suggest that we start to think about this as COVID infinity. And we really need to start to understand that, at least for the foreseeable future, maybe forever, or as they say in Rhode Island, forever, COVID is here to stay. It's not going to be a temporary phenomenon. It's likely to be with us for years, decades, or in perpetuity as a part of the way we walk through life. I do want to share with you that as somebody who's interfacing with all the clinical directors of health service programs in Rhode Island, and I'm part of what's called the Ivy Plus program, which is the Ivy League plus 3 additional schools, so 10 of us, we're keeping track of what one another is doing. We're keeping track of how one another is doing. And I want to share with you that there have been no severe cases of COVID leading to significant concerning health complications, certainly at Brown, even though 60% of students have had COVID that we know of at some point over the last 2.5 years, nor at any other campus at Brown at all. We are in the same program and process of determining now that we're at a place, given that students are fully vaccinated or almost fully vaccinated on campus, the vaccines have protected against severe disease. There haven't been any significant or frightening consequences of substance that's getting the attention of the Department of Health or Infectious Disease across the state of Rhode Island. All the universities and colleges, including Brown, both in Rhode Island and across the Ivy Plus programs, have instituted an isolation in place concept where students will be staying where they are with support unless there are unusual exceptions. And again, we're keeping very close track of this, both locally across the state and across the Ivies. We're one of the late to the party. Many of the Ivy Leagues went to this protocol in the springtime, and so far it seems to be functioning pretty well. Let's talk about monkeypox for a moment. I do want to share that we have gotten a lot of experience over the last 2.5 years with the concept of managing pandemic. And at the moment, we are fully well equipped for both screening, managing, and treating monkeypox should it become an issue on campus. We have all of our ducks in a row, all of our connections to the right medication specialists if necessary, as well as isolation protocols. And we're in very close and regular communication with the Department of Health and the Department of Infectious Disease. One of the things that I've come across in my role is there's this concern that I think that people may have about the transmissibility of monkeypox. And I do want to reassure you that there really has not been any true evidence of what I would call casual contact transmission of monkeypox that's been clearly demonstrated in the United States. There are a few cases of people who slept in beds of people who've been infected, so sharing sheets for quite a length of time. That's perhaps the one exception, but what we certainly know is things like tabletops, doorknobs, toilet seats, desks are not a source of transmission of monkeypox. I do want everyone to put their ear to the ground about influenza, the good old flu. We've had a couple of years, because people have been so far apart from one another, that flu hasn't had much of a presence. We have decades of experience with flu, and flu can really impact a campus, particularly an under-vaccinated campus. Part of the reason that I'm a little bit anxious about it is we actually have evidence from the Southern Hemisphere where they've just gotten through their winter. They're starting spring in Australia and New Zealand, and they had a very rocky influenza season this year. Quite a bit of illness passed around in the country. It doesn't mean we will, but I do think it's a little bit of a forewarning, and I want to urge everyone to urge their students to take advantage of the fact that we will be doing widespread vaccine campaigns across the campus, hoping to vaccinate each and every student that could possibly get the vaccine. It's not mandated, but it is something that I think is very, very highly recommended because it's quite contagious. And my experience has been the vast majority of students with flu tend to be more symptomatic than your typical vaccinated COVID positive college student. I just want to touch bases very quickly on a couple of the oldies but goodies. The CDC and the world of treatment have indicated that the way we treat very common infectious diseases and respiratory diseases has changed almost wholeheartedly over the past 2 to 3 years. It may catch many students and parents by surprise. I hope to at least lay the groundwork for why the change has taken place and to reassure that it's actually working just fine. I mean, I grew up in the good old days where my mother essentially said it was, if you had something, you went to the doctor, and the purpose to go to the doctor was to get on something. And that meant you go to the doctor, you come out with a pill that was an antibiotic, and that was sort of standard fare. That has changed quite a bit. And let me just give you the examples. The recommendation starting about 1.5 years ago is that bronchitis, which is something that we would always treat with antibiotics, starting now should never be treated with antibiotics ever again. And I want to share with you the risks from prolonging disease with antibiotics now with bronchitis far outweigh the benefits. And again, we can get into a little more detail perhaps at a different moment, but the CDC says bronchitis doesn't get treated with antibiotics. Sinus infectious or sinusitis only if you've had symptoms for 2 weeks, unless there are major mitigating symptoms or circumstances. What we do know is the more you treat sinus infection, the more it's prone to come back, and the more difficult it will be to treat each and every time, because you breed resistance, and we're sending more and more people to surgery because antibiotics are being used when, if you wait the time, your own individual immune system will be able to fight it off. And tonsillitis should only be treated in the vast majority of circumstances if it's strep positive. If you treat otherwise, it can both prolong symptoms and create resistance. So I'm sure that some of this will be shocking to some of you. I'm sure this might be a first pass for some of you. We're not going to go to war over this, but I at least want to bring it out there as an understanding that the world of antibiotic treatment is changing fast, and in part because it can, in certain circumstances, do more harm than good. And with that, I'll turn it back to Dr. Sullivan.
Thank you, Dr. Pallant. And I will echo what Dr. Pallant shared about our practicing evidence-based medicine in our health services. We really lean to published clinical guidelines to make sure that we're providing students with the gold standard care that they deserve. And part of that gold standard care is really recognizing the experience of a student who may be interfacing with health services. And part of our role is also to connect students with other resources on campus. So I just want to give a shout out and mention the essential roles of our student support deans, who we often refer or connect students to if they're experiencing a health or mental health related issue, because these deans can provide guidance and support around academic success. We also have our student accessibility services, which really assist students in managing accommodations, whether it be temporary or long-term. That can include academic accommodations, transportation, housing accommodations related to a functional impairment or disability. And then for our student athletes, we also work very closely with our athletic trainers, and they're really our liaisons between supporting a student's health and well-being and the coach and other members of athletics. The athletic trainers are really our main connectors, and also can offer students a wide array of supports as it relates to their health and their student athlete status. Next slide, please. And so just to reiterate some of the key resources, our website is newly renovated, which aligns nicely with our new building. So please check out our website. There is a wealth of resources there. The 24/7 phone numbers are listed here. We do have a dedicated registered dietitian who's board certified in disordered eating as well as sports nutrition, and her phone number is on the website. She has a lovely bio. It is a different phone number than the main number. Main number can easily transfer to nutrition. And then to reiterate, we have after hours medical advice that's non-emergent through our after hours nurse advice line. Students would call and speak to a nurse. And then our protocol is our nursing staff reaches out to a student the following day if they have connected with a nurse after hours. When needed, the calls are patched through to the on-call provider after hours. And then any medical emergency, we encourage and instruct students to call Brown DPS, and they can respond emergently with emergency medical services. Students non-urgently can reach out to us through the student portal. That's how we communicate with them regarding lab work or checking in electronically. And then we can also assist students with referrals to subspecialists in the area. So really, we want you and your student to consider our health services the primary care home away from home. So with that, I will turn it over to, this is another slide that just lists all of the additional resources available to students. This information is actually on the student's ID card. So and during orientation, it's highly encouraged that students take a minute and put all of these phone numbers in their phone, but just know that their swipe card actually has all of these phone numbers located right on the back. And I think with this, I'll hand it back over to Mikhail, and we'll dive into some questions.
Thank you, Tanya. Thank you, Vanessa and Adam. I think before we do questions, and we have a lot of questions in our Q&A and also that were submitted ahead of time, we'd like to have our Res Life and Campus Life colleagues give an overview because they're so interconnected. I think it'll be helpful for us to get the full view of how these services and teams all work together. So Dean Backegard, can you start us off on this end?
Sure. Thank you, Mikhail. It's good to be with you wherever you may be today. And thanks to my colleagues who have provided an overview of the services that are provided by the teams in health and wellness. I'll be very brief, but do want to provide some overview of how staff in the broader division of campus life and the teams that I work with also work to support students' health and well-being. Campus Life is a division of approximately 200 professional staff, and we also have 850 student staff who work with us across 18 centers and offices. And we all work together to support the social and emotional lives of our students so that they can engage fully with their experience at Brown and beyond. The areas that I oversee specifically are residential life, student activities, student conduct, and student support services. And together with our colleagues in health and wellness, in the identity centers, the chaplains, who are all of our colleagues in campus life, and many partners and colleagues beyond, including athletics, the college, Brown Dining Services, financial aid, and others. We really work to provide individualized support to students as they navigate their time at Brown. For us, this ranges from support for really routine developmental experiences that we would anticipate many students will experience as part of a major life transition into the university, all the way to more complicated or complex personal circumstances and situations. And we really work to build relationships with the students directly that we have the opportunity to center and adapt to what their specific and individual needs and circumstances are. At any time, if students are unsure what they need or where to start, our staff who are in residential life, who are in student support services, and our 24/7 administrator on call position, these are great generalists who are well positioned to help students find what they need and get connected to the right resources. And with that, I'll pause so that we have more time for questions.
And can we have Dean Ice? Would you be able to give your perspective, and then we will kick it off to questions. Thank you.
Hello, everyone. Brenda Ice here, Senior Associate Dean and Senior Director of Residential Life. I will only add on to what Dean Backegard has already provided as an overview of what Res Life does. In addition to those 850 students that we talked about are student leaders. Many of them work under our auspices of Res Life as community coordinators. And so these are our peer leaders and mentors that are actually living in the same space as your students, offering a kind of living and walking resource to them, that they are educated and trained from our office on the various resources available to all students at Brown. And then they serve as kind of that connector of when a student on their hall presents a question, challenge, or issue, they know where those resources are located, and I can either direct them to them, or if it's additional information that is needed, they have a tiered approach in our process with our area coordinators who are live-in practitioners who also live in the building, who can then step in and kind of assist with those particular resources. Dr. Brito also mentioned the partnership that we have with them in Stern Lake Commons, this idea of a co-locating of health and wellness as a holistic view. We provide 163 residential bed spaces in that location. And our students actually go through an application process to show a commitment to holistic wellness, that it is not fundamentally grounded in yoga practices. It is thinking more broadly about all things that make them healthy and well. And through that application process, we're able to actually work with those practitioners in the building and create some programming that best supports our students. I'll end by saying is that our job, particularly in Res Life, is to create this environment where students feel welcome, safe, and then can create a home away from home. And I hope with the team that we have in place, we're able to accomplish that. But certainly welcome your feedback through questions today, and even more broadly throughout their residential experience. If that's not the environment in which they're receiving, we want to make sure that we attend to that as quickly as we can, so that everyone feels comfortable while they're here with us at Brown. Thank you, Mikhail.
Thank you, everyone. Let's dive into questions. I'm going to start with you, Vanessa, and just some quick hits on COVID. We've had a lot of questions about COVID. First one is, will you be offering COVID boosters and also flu shots this fall for students?
Thank you, Mikhail. Yes, absolutely. We are preparing now, and actually this week we'll be starting with students who are in the medical school, providing flu shots for those students. It's mandatory for those students and healthcare workers in Rhode Island in general to receive flu vaccines. So we will be starting with the medical school and then rolling out over the coming weeks to the general student body, flu vaccines. We plan 9 or 10 clinics over the course of the next few weeks. So students will be hearing about that. And yes, we also plan to offer bivalent COVID boosters for students. We are working very, very closely, as Dr. Pallant mentioned. We work very closely in general with RIDO, the Rhode Island Department of Health. And that's also the case in terms of the procurement of bivalent COVID boosters. So we are in queue, and we are preparing to stand up a COVID booster clinic. Probably more than one, probably a series of them based on demand. And we're just waiting for more supply to be made available to us.
Does that carry over to faculty and staff?
The COVID clinics that we'll be standing up will be for students. There will be other mechanisms for faculty and staff through UHR to obtain both flu and COVID vaccines.
Thank you. We've received many questions about how students are to manage when a person either living with them or in their community is diagnosed with COVID. And I know this is something that we faced last year as well. Could you talk about the protocols around that?
Sure. And I would certainly invite others on the team to join in terms of providing a full response. We began communicating with students over the summer in terms of thinking about COVID and how students might manage COVID between roommates or suite mates. It was important for us to start to think about transitioning to managing COVID in the same ways that we manage many of the other infectious diseases, as Dr. Pallant mentioned. Influenza has been something that we've had a lot of experience with over decades, and we've come to understand a great deal about how to manage COVID as well, given the last 2.5 years. And so universal vaccination or near universal vaccination has been very important and foundational to us. And so that's certainly been a pillar in our management of this issue. We wanted students to have access to test kits so that when students came, certainly even before arriving, that they had an opportunity to test before arriving, but certainly upon arrival and while they're here, that they have access to a test kit. We recommend that students have test kits on hand. We've made some available in partnership with our Res Life colleagues, so that students can obtain them here on campus, along with masks. And we definitely want students to monitor their symptoms. If they're not feeling well, to certainly not go into the classroom. We want students to test, and if they're positive, we have a portal that we want students to use to report their tests to us. And that's a mechanism that allows them to then communicate with our nursing team and the health service team, who can then again begin to wrap services around students from the standpoint of, connecting them to dining and connecting them to other services on campus. And it's certainly others on the call can go on into more detail about what those services are. We also, in the communication that we had with students, really asked them to start to think about what managing COVID might be like if they or their roommate was positive. And that conversation we want to continue. It's, we certainly wanted students to begin it, but we don't want that necessarily to be the last, arriving, having that conversation before arriving to be the last time that they engage in that dialogue. If students are in a roommate configuration or a suite mate configuration, certainly the suite mate who is not positive has the opportunity to stay with a friend or stay with family who might be in the area if they choose. And we certainly can work with students in terms of how to navigate that. And if there are any questions around how to do so, we can certainly talk through that with them. We again have the nursing team available to students should there be any questions, clinical questions about how they're feeling or what they might need. And we certainly have a whole separate clinic that's dedicated to managing and diagnosing respiratory illnesses, so we can help students in a very expedited way. So I'll stop there and let others join in to add anything that they'd like.
Yeah, thank you, Dr. Brito. Dean Backergard?
Yeah, I just wanted to pick up a little bit of what Dr. Brito was describing around the support for students whose roommate tests positive. I mentioned before that we really want to take a highly individualized approach to working with our students. So we want the students who are in that situation and affected in need of support and resources in navigating that to reach out to us. In the letter that we sent this summer, I think August 8th was the date of that communication to all students. We really mentioned for them to contact Residential Life if their roommate tests positive and they're seeking support. Now that they're on campus, they likely know who their area coordinator is, and that's a great first step for them to take. If they don't know who their area coordinator is, or they're not sure how to get in touch with that person, I mentioned before that our administrator on call system is in operation 24/7. That phone number, as Tanya mentioned, is on the back of students' ID cards, so they can call and connect with the administrator on call at any time. And we really want to work with them to identify and think through what their options and alternatives might be. And if they need to obtain alternate housing, we can work with them to do that. But for many of our students, a better option is going to be to find somewhere that they feel comfortable staying during that period of time. So we're available to help support every student through that process if they find themselves in that situation and are in need of some support.
Thank you so much, Corin. I don't know, Dean Ice, do you want to talk a little bit more about what kind of advising takes place in the dorms? We've had a few questions about, where do students pick up a COVID test? Where does a student, how do they learn about health services? And their supports within Res Life right in their halls. Can you talk a little bit about that?
Sure. So we have a kind of layered approach to supporting our students who live with us residentially. We have our peer program, which I mentioned earlier, as our community coordinators. So these would be what many of you may know as traditional RA roles. Here at Brown, we call them community coordinators because their main purpose is about engaging the community and bringing folks together in a welcoming and safe environment. And so they are hired and brought back to campus a few weeks earlier than most students to go through a very comprehensive training with our professional staff so that they understand not only the hows and whys behind their role, but then really get the education of all of the resources available to them, that they are students themselves. And for many of them, they know these resources exist, but didn't actually kind of do the connect the dots, if you will, how these resources actually benefit everyone and not necessarily go to them in the 11th hour when they might need them. So we spend a lot of time with them engaging with these practitioners, my colleagues and campus partners, and educating them around where offices are located, the services that they provide. And then they take this information and turn that into passive and in-person and or active programming. Passive programming for us is a bulletin board or a QR code that they've got strategically placed around campus on their halls or inside their rooms for students to say, if you need this, scan this, or if you're looking for important numbers, they're not only located on the back of your ID card, but you can also find them on our bulletin boards. All community coordinators have a designated location on their door for additional key information for them to have as a resource. In addition to the peers living in residence with them, our 10 area coordinators currently on staff are master's level professionals who also live in residence with them. And they have been making themselves known and present throughout the community. They engaged with them when they moved in, whether they were a new student or returning student. We made it a point for folks to put names and faces with our staff that are living in residence with them. Between the CC and the AC, our area coordinator roles, we believe that we've created this kind of high touch in the living environment that gets them the resources that they absolutely need. And in the event that they're unable to find that individual in the moment, there's always our administrator on call protocol that they can simply call, and the number has been provided a few times for you, and that will connect them to a member of our campus life unit, primarily in residential life, who then again knows all of the resources and information that's available to students to get them to connected to the information they need in the moment, or depending on the level of urgency, for it to be communicated next business day to an office that can better support their needs.
Thank you, Dean Ice. Let's talk a little bit about mental health services that are available on campus. Let's see, Dean Backagar, do you want to talk about student support services? And then maybe somebody from the health and wellness team can talk about what we call CAPS.
Sure, I'll characterize student support services. In some ways, this is a team who are the hub for connecting students to resources and support, whatever the nature and variety of that be. So we often say if students are not sure where else to go, student support service is a great place to start. There may be times when they have one meeting with a student and have an opportunity to talk about the student's issues and concerns and challenges and to connect them with those resources. And it may be that students will work with student support services over their entire time at Brown. And both of these are just fine. And we want to make sure students know there's not a limit on the number of times that they can be connecting with and working with student support services around one issue or many issues. The student support services deans are not, however, therapists or clinicians. That's not our role and scope, but to help students think through options, to identify resources, to connect with those, and to be thought partners for students as they're navigating their time at Brown. So the student support services deans are working very closely with deans in the colleges who provide academic advising, are working with our colleagues in counseling and psychological services and student accessibility services. So to know that that's a very good place for students to start if they're not sure what they need, or if what they need is connection to a range of resources around a complex issue. And we want to make sure that we are making those connections and referrals to our colleagues in counseling and psychological services when there's something that really needs a more clinical or therapeutic approach to the student situation.
Thank you. And I don't know if somebody from the health services team, maybe Tanya, do you want to talk a little bit about how your team
Sure.
works with CAPS?
Sure, absolutely. So students don't need to be referred to counseling and psychological services. As I mentioned, they're located right in our health and wellness building. Students can call CAPS directly to schedule an appointment. Their current access model is that when a student reaches out to CAPS to schedule an appointment, they'll schedule a 30-minute intake appointment, which will really be an initial assessment by a licensed therapist to determine what the student's needs are. And then based on that intake, then they may be scheduled for additional appointments, or another recommendation may be made, such as connecting with health services or connecting with an off-campus therapist or prescriber. So their model is really a either short-term or intermittent scheduling model. So some students are seen longitudinally through CAPS, but really it's based on the individual student's needs and the assessment of the professional therapist in CAPS who's working with that student. So students can also walk into CAPS and request an urgent appointment. And there's someone in our greeter station who is available to assist with students connecting to the urgent provider in CAPS, which is a daily provider who's assigned to assist students who walk in who need an urgent appointment. And then additionally, as Dean Backegard mentioned, students can be referred or encouraged to reach out to a CAPS therapist by either a student support dean or by someone in residential life, potentially by a friend. Oftentimes, word of mouth of peers is really a great way for students to feel comfortable connecting to professional support. And then when a student is seen in CAPS, it would not be uncommon for recommendations to be made for the student to also then connect with student support deans or student accessibility services or health services, because it's really a web of support around students. So there's a lot of cross collaboration that occurs throughout campus life.
Tanya, I want to stay with you just a minute and ask, we're going to go back to COVID for just a second. One, should students report a positive test result? Two, and what happens once they've done that?
Thank you for asking that question. I did put a comment in the chat, and this has been communicated out to students broadly and repeatedly, but we also really appreciate parents and families being in close contact with students and encouraging this one-on-one. Students who do test positive for COVID, and I did put in the chat also the location where students can pick up tests as well as high quality KN95 masks. That's in the key office that's overseen by residential life. And students can report a positive test result very easily on their student health portal, which all students are familiar with because that's how they've had to log in to input their immunization records and submit their health history form, and also their main communication tool in working with health services providers. When they submit that form to us, students receive an immediate message that gives them confirmation that we received their result, but also instructions about what to do and what to expect. So it walks students through how do they determine their isolation period based on either their onset of symptoms or the date of the positive test. And then what our professional clinical staff do is we put all of this information into a system where not only do we have knowledge that they've tested positive from a medical standpoint, and we ask students to reach out if they have symptoms of concern, which by and large, a majority of our students do not have because we have a highly vaccinated campus. But also if they have questions that are clinical, we encourage them to reach out to speak with a nurse or schedule a telehealth appointment with a provider. We do have a respiratory clinic where we can see students who have a diagnosis of COVID or may have COVID, and we can do COVID testing. That's really dedicated to respiratory care. But then in addition to that, students get access to a isolation Google site. And we've started this early on in the COVID pandemic, and it's really evolved and changed to ensure students have access to 24/7 medical resources. So all of the phone numbers are right there, right on a Google site, as well as the link to student accessibility services, student support services. If they have a question about how or where they can go and pick up grab and go meals, the location, a picture of the dining hall, and the hours are all right there. Students can also request if they're feeling unwell, but they're able to manage their symptoms on their own, which we see. So sometimes students feel like they have a really lousy upper respiratory infection, like just a nasty cold. They don't need to be seen medically. They know how to take care of their symptoms, or maybe we've walked through how to manage their symptoms with them and they feel comfortable with that plan, but they really don't feel well enough to go and get grab and go food. We have implemented a system called Sick Support, where a provider or nurse in health services will enter them in the system, and our Brown EMS colleagues will bring food to the student. So it would be the same grab and go meal bundle, but it will actually be hand delivered to their room if they're feeling like that would be beneficial. And that really speaks to options that we've developed and refined and evolved over the COVID pandemic, but it actually applies to other illnesses too. So for example, if a student has influenza, we can implement the same sick support for a student. So EMS would be able to deliver meals, EMS can deliver medications if needed, and students can also arrange for those things through this Google site that we've developed to make sure they have one location to access all of the resources that they might need.
Thank you so much.
You're welcome.
I don't want to forget about monkeypox. How could we forget about monkeypox? Dr. Pallant, can you talk about what the current thinking is? Is there concern of an outbreak down the road somewhere?
Yeah, I wish I could read the future. If I could, I'd have you tell me what stock to invest in. Although, if you would like me to predict, I think it's not going to be a significant outbreak or concern. It is clearly very, very different than COVID. COVID does have the ability to spread through respiratory means. If you were to go and do a deep dive, there is a description that monkeypox may have the capacity to spread respiratorily. I don't want to go into too much biochemistry, but this particular strain has not been doing that. And even if you were the understood time, this is mostly for healthcare workers like myself or who work in the hospital, the risk for getting spread through non-causal contact respiratory would require at least a 3-hour interface with somebody less than 6 feet, no mask. So at the moment, the burden of illness is very predominantly in the population of individuals who are men who have sex with other men. It has not at this point gone to other populations, although it will, and it really is people who are in physical contact with one another. There has not been any evidence of, spread on campuses anywhere in the United States, wondering how it got there. So I'm not worried that we're going to have to think about how to go through some major protective process, even if it were to show up on campus, for our student well-being.
Thank you. I'm not sure you have the answer to this one, but if not, maybe somebody else on the team. There was a question about how students are charged for EMT services.
Sure. And I saw there are a couple of housekeeping things. They're not. How's that? You're not charged for EMS services. There's a very, very, very rare occasion. In the last 5 years, it's happened 3 times. The services of the clinicians, the nurse practitioners, physicians, PAs, therapists on campus, we are, our salaries come from your tuition and fees. Thank you very much. And so we don't charge insurances for our services, nor does EMS. That's all covered. Anytime someone walks in the building to see a clinician or needs care by our EMS or transportation, that's free. There's the one caveat, because there's always the what if. There's a very rare occasion where our ambulance is transporting someone, is sitting in an emergency room queue to drop someone off, but doesn't know when they'll be able to transfer that student, and someone else is calling in and feels that they can't wait for the return. That could incur a charge, because we would call a city or community-based ambulance to make sure that student got immediately to care, and that's outside of our system, but that's a once-a-year event. I also saw somebody ask a question about whether or not an internationally based physician can prescribe standing medications to our pharmacy. And the answer is, unfortunately, no. Our pharmacy in the United States can only accept prescriptions from a physician with an American license number. That's called an NPI number. So anybody who has a student that's in that circumstance, just have them come and see any one of the clinicians here. Remember, we don't charge for that student to come to see us as long as they're a Brown student, and we will work with them to make sure they have their prescriptions prescribed by us while they're in the US.
Thank you. I want to send the next question to Dean Ice. We had a lot of folks asking various questions about, what if my student wants to move out or temporarily, in terms of something going on with their roommate, whether it is a sleep issue or a COVID diagnosis or just a mismatch. What are your recommendations, first off, for first steps when there might be these bumps in the road with roommates? And then what are students' options to change the living situation when they need to?
Sure. So I do just want to clarify that if there is a request for a change in housing related to COVID, then we're going to revert back to the protocols that we've been discussing in today's conversation about ways they could do outreach, either with their community coordinator or with our administrator on call. And we would work with them to figure out if there are alternative solutions if they do not feel comfortable living in the space temporarily while their roommate is managing COVID. Independent of that, we do have a 2-week freeze in most instances where we ask all students to pause and request for room changes. Particularly in our first year community, we often find is that folks think that they are not going to be compatible simply because of what they brought into their room, or after the first night of activity, that this isn't just simply going to work. That 2-week period is both what we're referring to professionally as like a honeymoon period, if you will, that we really want folks to kind of settle into what it means to be a college student here at Brown, and start to discover who they are and how they plan to show up in this particular experience. So they would have filled out their housing questionnaire in the early parts of the summer, and now have an opportunity to actually execute all those things that they said they were going to do, when they were going to wake, how they were going to utilize their room. That was theoretical. We're now in the practice period of that working out. If after that period, that they still feel like it's simply not going to work out, then we do have mechanisms in place. All first year students would have gone in the first week of their time here, met with their community coordinator and filled out a roommate agreement. And that's basically an additional contract to say, here's how we're going to navigate our space. Here's how we're going to live together. And then if after that 2-week period, they feel like there still needs to be a room change, we start with the roommate contract to see if there's moments where we can make adjustments. If we're unable to meet that and we still believe that there is a conflict, then we can look to see if space is available, if we can make those types of changes. We don't have an abundance of spaces available or a magical building that I can move those conflicts to. And so that is part of the reason why we want to be included in those conversations to see if many of those room changes can actually be mediated rather than just simply going through a room change or swap.
Thank you. And unfortunately, we are at the end of our time together. And I want to thank everyone who joined us today from wherever you are. We do appreciate your participation and your questions. And I want to thank my wonderful colleagues for sharing information on how Brown supports health and wellness for your students. We are here for them. And if you do have additional questions after this webinar, please contact family@brown.edu and we will make sure that it gets to the right area. Have a wonderful day, everybody, and we will see you again soon. Take care.